Do you have one of those fancy wearable devices that tracks your sleep? How reliable are those things? Could they help detect something like a serious sleep disorder like sleep apnea? How detrimental is sleep apnea on physical and mental health? What are the latest treatment innovations for sleep apnea? Can psychedelics help people with personality disorders? Could 5-MeO DMT help reduce excessive alcohol consumption? Could LSD be used to treat anxiety? What happens when you let people self-regulate a DMT dose through an IV? Well, in today's episode of the Psychedelic Therapy Frontiers podcast, we share data and reports from a number of studies that seek to answer these questions. For those of you who are new to the show, welcome. Psychedelic Therapy Frontiers is brought to you by Numinous Network and is hosted by me, Dr. Steve Thayer, and my co-host, Dr. Reid Robison. Just a few announcements for you before we get into the episode. If you're looking for comprehensive foundational training in psychedelic-assisted therapy that includes live online classes, experiential learning, and opportunities to connect with a diverse community of practitioners in the psychedelic medicine space, then check out our courses. We're offering a 10% discount on select courses to PTF podcast listeners. So click on the link in the show notes or go directly to numinous.com/training, and you can use the code PTF10 for that 10% discount. If you've listened to the show for a while, you've likely heard Reid and I talk about the psychedelic clinical trial work that Numinous Network does. Indeed, we talk about it in today's episode. If you or someone you know is interested in being a participant in a psychedelic clinical trial, you can click on the link in the show notes or go directly to numinous.com/research to learn more about the trials we're currently running. And finally, if you'd like to support our show, you can do so by leaving a rating or review in places like Apple Podcasts and Spotify. If you're watching on YouTube, please like the video, subscribe to the YouTube channel, maybe even share this episode with someone you think might enjoy it. Without further delay, here's our episode featuring a number of studies on a number of interesting questions. Well, Reid, we decided today to do another one of our sort of eclectic a la carte research study episodes where we just sort of pick up a few interesting studies, talk about them a little bit, some psychedelic related, some not.
We cannot help ourselves.
That's what happens when you're kind of a research geek and just can't, I can't stop myself from wanting to learn more about the latest and greatest cool stuff out there.
Yeah, that's why I went into this profession when evaluating all the fields of medicine. And this was even before med school. There was this unexplored frontier of the human brain and behavior. And things like sleep that, I have a couple studies on today to report on, which is a classic example of something we do not fully understand. Not to mention the hard problem of consciousness, but we won't go there today, most likely.
Yeah, exactly. Well, I think, you and I were chatting a little bit this week about sleep. This is an example of research being me search. You and I have both experienced our own challenges with sleep, and then, of course, try to help our clients and patients with their sleep challenges. So that keeps my interest fresh in the latest on sleep science. So we'll talk about a few of those things and maybe provide some personal anecdotes.
Yeah, and definitely. Let's go there, and then that'll give us a chance to make a plug for things like sleep apnea awareness, testing, etc. But why don't we start with a study? A study that came out late last year, August. Actually, it was published in October 2024. And it's called Accuracy of 3 Commercial Wearable Devices for Sleep Tracking in Healthy Adults. And this is out of Harvard, Brigham and Women's Hospital in Boston, one of the most famous Ivy League academic training hospitals out there. And Oura Ring loves to highlight this study because theirs came out on top above Apple Watch and Fitbit. So the reason this is of interest is because I think it's a question relevant to most people who have ever struggled with insomnia or sleep difficulty of any kind, which is most people, right? The vast majority of people. And sleep tracking has come a long way, even in recent years and months, it seems, where what used to take multiple contraptions that were quite cumbersome and uncomfortable can now be done on a little watcher ring, including like this ring I'm wearing. And this is not a paid endorsement from Oura Ring, unfortunately, because we would like an endorsement from their budget.
Yeah, seriously.
Perhaps. I mean, we haven't even talked about the ethical taking of funds from people. So I'm just shooting from the hip here.
Well, it frees us up to give honest reviews. Not that we wouldn't if we were being sponsored. We would, of course, make that clear to any sponsors. But yeah, so what does this say?
And bias, I'm going to take any tangent opportunity I have here because bias exists everywhere. I'm just remembering when I was at the University of Utah, starting out my clinical trials career. This is fresh out of residency and fellowship training. I think I got my first job in, when was this? 2009, as a faculty member. And I remember as I started working with pharma companies doing clinical trials for drug companies, and then sometimes applying for funding for our own trial ideas from pharma and having to disclose all these on the IRB applications and ethics boards. And I remember talking to some really wise old board member of the IRB at the university. And he's like, conflict of interest does not mean bad. Conflict of interests are neither bad nor good. What's important is that they're well managed and disclosed and well managed. And so anyway, I'm just highlighting what you said here of, like we'd need to disclose that if we were, and we'd still try to be truthful.
Well, it's to your point about bias generally, right? Like bias in science is not sort of good or bad. It's this sort of state of reality. And so if to whatever extent we can control for bias with the scientific method and double blinds and placebo controls, we do that, but we also acknowledge limitations in every study that we do and disclose our potential conflicts of interests. So we put the results into context. Yeah,
there you go. So here is me reporting on this Harvard study of sleep trackers without any financial conflicts of interest to disclose, but I'm disclosing that I'm wearing an Oura ring for what it's worth that I paid for. But anyway, they took, first of all, what's the gold standard here? What's the gold standard, and what are they trying to track? What does it mean by accuracy in this case? They're looking at accuracy of the sleep stages that are being reported, like both like onset of sleep detection, wake detection, things like deep sleep detection, and then the four main sleep stages that sleep trackers and their apps report on. And the gold standard here is polysomnography, which is overnight sleep monitoring. Poly meaning everything sleep, and generally means going into a sleep clinic or hospital and doing it overnight, hooked up to a bunch of stuff in a hospital bed, or hopefully they have something slightly better, a comfortable hospital bed.
Yeah, but they usually put a lamp in there to make it feel like a living room, or like a bedroom, but
like we do with our psychedelic therapy dosing rooms.
Right. Make it as homey as possible.
Where the protocol will say, no windows. And sometimes the sponsor of the protocol will say, here's the art and the lamp to be used because we need consistent set and setting across study sites.
Right.
Anyway, I digress again. But so polysomnography is thought to be, as the gold standard, about 83% spot on of biology, right? 83% sleep stage agreement, or meaning like if you had sleep technicians reading sleep studies, polysomnography data, there would be 83% agreement across a handful of them reading the same night. So anyway, it's the gold standard isn't perfect to begin with, but that's not that important here because we're looking at how these do compared to that benchmark. And it was the Oura Ring came out 5% more accurate than Apple Watch, 10% more accurate in Fitbit, and had the highest sensitivity for detections of wake up and falling asleep. And didn't significantly underestimate or overestimate any of the 4 sleep stages, where Apple Watch tended to overestimate your light sleep by an
Mm.
average of 45 minutes and your deep sleep. So by an average of 43 minutes, which is interesting. Like, how much does that matter? Sounds like it sounds like a lot. And it's also data that is of questionable actionable utility for the average person, right?
Mm-hmm.
At least the minutes of your deep sleep, you're going to try and sleep more, right? In general. And it's going to report these sleep stages, and you're going to care about deep sleep more than light because it sounds better, right?
Yeah, it makes me wonder about when you mentioned the utility of these data, right? And I've also heard some criticisms of these trackers that sometimes, as they're innovating, they might be changing the software on the back end. And so, after an update, all of a sudden, you see sleep trends in your stages change, and it might not be because your actual sleep is changing. It could be because the way that they measure, um,
Yeah.
the readings has changed.
And that's, it's a very good point, and why I really strongly believe that these companies have a huge ethical responsibility to, like we take an oath to do in medicine, of do no harm, and to be transparent as much as possible about their data and algorithms. Because, for example, the Aura Ring, Aura research scientists, they're in Europe, I believe. When I had to return a faulty thing in once, I had to send it across the pond.
Mm.
And but they've developed this sleep staging algorithm. They say is 79% agreement with the gold standard. Um, so anyway, very close to what the polysomnography is doing. And they have done this by using machine learning and by amassing the largest database, as they've been in the market for several years and had good market traction, the largest database of sleep data for this
Mm-hmm.
kind of thing. So, but, and I do believe, I trust this, but I would love the companies like this to address it more, is that, that they are aware of that risk and attentive to the impact of a sudden change on someone's, like, just the impact of that psychologically on someone too. Um, and updates and user interface changes can all matter.
Right. And that's why I bring it up, because if we zoom out and ask ourselves the question, why track your sleep at all? Usually people are interested in sort of optimizing sleep for performance, or if they're having trouble with sleep, they want to get some data, like what's going on? Why don't I feel rested in the morning? And people can get a little preoccupied with the tracking. And then all of a sudden it's like with insomnia, you're thinking really hard about losing sleep, which makes it difficult to sleep. And then you're agonizing about your sleep, and it has this paradoxical effect. Sometimes people can get a little too obsessed about these data and overinterpret them. But
Yeah.
also, why it might be interesting to track sleep is to see what is changing, what has an effect on your sleep architecture. So you hear Peter Attia, who is often talks about sleep tracking in the Aura Ring, about how just 1 or 2 glasses of wine, and he notices there's a difference in his sleep architecture as measured by the Aura Ring, and the readiness score or whatever that it gives you based on
So
that data.
they're not going to drink likely as many. They might be more likely to pass on that glass of wine, for better or for worse. I'm not commenting on, like, they
Mm-hmm.
may be at at the fanciest vegan wedding, toasting someone where they really want to partake but can't let themselves go there because it'll throw off their sleep score. And does that matter? You know what I mean?
Mm-hmm. Mm-hmm.
But so anyway, these there's even a paper that's been written. I won't review it here, but on the ethics of sleep tracking, and the title is kind of fun. It says techno-ethical particularities of consumer-led sleep tracking with a focus on medicalization, vulnerability, and relationality. So there's a lot to what you're pointing out, but I think, I'll leave it there and say that I've had to find that balance for myself of mostly just ignoring sleep scores. Same with HRV. Like you don't put it up against heart rate variability. You don't put it up against the norms because there's nothing you can do about that, right? You put it up against your own reliable data over time if you want to go there. And but with sleep, that's kind of the way I use it. Is I used to probably put on too many cumbersome trackers too often to try and get data that was of questionable value. But now, I'll just try to have the Ring, or before this, it was the Apple Watch on, which was a little, some would say a little bulkier, harder to wear, but it's still pretty easy compared to what traditional sleep trackers are like big giant watches.
Right.
But I use that, and I find a lot of good value out of the data. The reason I use it these days is more for the oxygen tracking, and that's why I've had to put on different kind of devices, like an O2 ring that we've used in ketamine rooms in clinics for remote continuous monitoring of oxygen, because most trackers have not until now had that built in. And even Apple Watch, even if they do, there have been like both patent lawsuits and kind of conservative stance with the tech, where they're not showing you a tracing of your oxygen through the night. Apple Watch will, in the sleep apnea category, they'll report on breathing irregularities and suggest that you go get screened.
Mm-hmm.
Great step for now. Oura Ring takes it a bit further, and they'll give you a kind of an abbreviated chart of your oxygen through the night, and they'll comment on breathing abnormalities categorically as well. So I like what they give. The data scientist in me wants more data out of it, but I also think it's good. It's a good amount of data, practically speaking, for what I want and need, and the rest might just overwhelm.
Yeah, I think, the example of O2 saturation respiration rate is an example of what, like, the real clinical utility or life utility of a tracker like this, because it can indicate that there might be a medical problem like sleep apnea, and then prompt you to go talk to your doctor, right? Go get a sleep study. I know that there are a lot of people who suffer with sleep apnea and don't know it, right? Maybe they don't have the privilege of sleeping with a partner that can tell them, oh, you snore and then you suffocate for 60 seconds at a time throughout the night. Maybe there's a problem here. A lot of people just feel like garbage, and they don't realize it's because they're hypoxic at night multiple times a night. So you wear something like an Oura Ring or an Apple Watch, and it tells you, oh, there might be some going on with your O2 levels, and then you go get it checked out.
Yeah, no, and I think it's worth going there as a public service announcement to just pause this programming for a commercial from our sponsor, the unofficial nonprofit that plugs science facts into Psychedelic Therapy Frontiers here. Like obstructive sleep apnea is thought to affect 1 billion people on the planet, and at least 80% of them do not know it. But if you look at age 30 to 70 adults, the latest figures are 26%. And I think I was telling you, I had a consult call with a group called Absolute Rest yesterday. I think it was Andy Galpin's group.
Yep.
And Matt Walker's part of that advisory board now, where they've put together the best sleep assessment and monitoring possible. It's kind of like Brian Johnson's Don't Die campaign, but applied to sleep. And they charge, a boatload for it. But I think it's kind of cool to see and follow and learn about, like, okay, it's translational science, right? It's the first step from bench to bedside. And it's interesting. They get all this data at first for 2 nights, but then they just have you wear one tracker, like their watch thing, that gives enough data, gives the data you need to make actionable adjustments along the way, including how much total sleep you're getting, or if you want to get in the stages. But it usually doesn't change what you're going to do. And then, of course, the oxygen is relevant to a lot of people. But because sleep apnea, I guess, as the second most common sleep disorder, insomnia being number one, just means the upper airway is blocked while you're sleeping, but it's ranked in severity by these apnea hypopnea index scores, AHI, where mild is like you're getting 5 to 14, moderate 15 to 30, kind of like we do with depression rating scales. And nowadays you can test this at home. So part of why I like to plug this is because, well, one, it's been part of my personal journey, finding this out and trying to find the right interventions, over the past year or two. But also because now you don't have to go into a clinic or facility. There's good, I'm not talking about the sleep trackers, but there are good, 1 or 2 night home sleep studies. I've prescribed them. I've done them. I've seen people do them all the time that are kind of game changing for access to this kind of information that can be life-saving, because it is such a driving force between hypertension, coronary disease, pulmonary hypertension, stroke. Sleep apnea pretty much doubles your all-cause mortality and almost triples your cardiac mortality untreated. And not to mention the other risks of injury and the impact on your cognition, or what they say, $150 billion lost to productivity annually. Anyway, that's my sleep apnea public service rant. Yeah.
Yeah. I mean, in addition to all those things, also your mental health. I remember when I was a psychologist in the Air Force, I had a psychiatrist friend of mine his crusade was to make sure that a lot of these airmen would get sleep studies, because they'd come in with depression and fatigue and low motivation, all these symptoms of depression. And certainly he'd do a comprehensive eval, but let's go get you a sleep study if they showed, potential signs that they might have sleep apnea. And for a lot of those folks, just getting their sleep apnea treated, and it was a tide that lifted all the boats, including the boat of mood. Yeah.
And in fact, there was it's a really good point, because when we're seeing someone with a constellation of symptoms that often presents in mental health clinic, some in your sleep category, some in your mood and your cognition, for example, because something like depression impacts all those things, but other things do as well. And we'll go for the, just like you would in evaluating something like, dementia or some medical condition of another organ system. You want to rule out all the low-hanging fruit, actionable, organic causes of something before, assuming that we're going to address it by this kind of serotonin, norepinephrine medication psychotherapy approach, because there may be something like low testosterone or a sleep disorder spilling into the daytime. And I think there was a study last fall, a neuroimaging study of sleep apnea, that showed that severe untreated sleep apnea changed your white matter fiber integrity, they called it, in multiple different brain areas and pathways. And this was linked to impairments in cognition, mood, in addition to daytime alertness. But then 1 year of CPAP in this study, which is kind of a cool study, completely reversed the white matter changes, the brain damage, if you will.
Wow.
And one more stat that I think the Galpin group told me yesterday is 80% of people who start, 70-something% people who start CPAP aren't doing it in 6 months, just because it's hard to tolerate.
Yeah, so maybe we could talk about maybe just different treatment options just as part of that PSA. But I do want to riff on sort of these, what I like to call upstream areas of focus. So if you go to I've been to a lot of physical therapists in my life because of sports injuries. And so if you notice there's pain in your knee, a good physical therapist will also look upstream. They'll look at how or downstream. They'll look at how your feet are doing, or they'll look at your hip, or even up at your neck. And sometimes I've been to a physical therapist where he's not even touching my knee, even though I came in with knee pain. He's working on my hip mobility and alignment and strength imbalances in my glutes, and like addressing those things address the pain in the knee. So you apply that to mental health. There could be something like sleep apnea that's upstream from your depression symptoms, your cognition issues, memory problems, what have you, anxiety, that if you were to address, then maybe you don't need the antidepressant necessarily.
Yeah. And I'll say that more often than not, it's a combination of factors, or more often than not, it's just one single driving force that is all of the equation. But quite often, tackling that one thing, especially the treatable things, right? Mm-hmm. The easily addressable things that we might call the low-hanging fruit in this case, often does more than enough to get you back to better than a baseline and able to work on the other stuff with a new vigor. Yeah.
Right. So maybe just a quick plug for different treatment options for sleep apnea. Not that neither you nor I are sleep physicians necessarily, but given our interest in this, I've learned a few things about what's available to people. You mentioned the CPAP. So that's like, the dreaded Darth Vader mask that you wear, and it's either covering both your nose and your mouth or just your nose, or they have ones like called the nasal pillow that just sort of go under your nasal passages, your nostrils. The idea is it's blowing air into the airway to keep it open, not enough that, you feel like you're suffocating. And that's sort of the sort of first line of defense, the standard treatment for sleep apnea. But like the stat that you shared implied, a lot of people have a hard time tolerating the CPAP machine.
Yeah. And that's a tricky part of medicine, because you get a diagnosis, you get sent a machine to your home, and a lot of people fail, right? A lot of people, like, fail's a harsh word, but I'm
the machine fails them.
On purpose. Yeah. Like, fail to find benefit from this strange contraption when left to just figure it out. So it is kind of the gold standard and the most kind of rock solid intervention to take care of moderate to severe sleep apnea. But I'm glad you mentioned options, because there are many that are just unknown. It's a disparate field in medicine where you need to go to a sleep physician who can come from multiple different pathways themselves to get a diagnosis and CPAP. But there's this field of sleep dentistry that has the appliances, the oral appliances that can be a great option for some people, much less cumbersome. And but then what about all the positional sleep therapies and the behavioral changes? Are the clinics really taking the time to look at those things and work on them? In addition to the weird landscape of FDA-approved treatments like a surgical option, laser option, and then just a recently approved first ever med for it last month for sleep apnea.
Yeah, so many different options, right? Like you mentioned the dentistry. They have these mandibular advancement devices that will sort of hold your lower jaw forward, just like a giant retainer, this sort of oral appliance to keep your airway open. But, there are challenges with that. And then the surgery, you mentioned laser. Some people actually will get a surgery where they go in and carve out the uvula. They cut out some of your soft palate to, or shave down your tongue if your tongue down deep in your throat is a little bit too big. And I had a friend who had that done, and it helped, but it changed his voice for a while. And when he swallowed, the food would go up into his nasal passages sometimes. And where there's nasal surgeries, where they'll go in there and correct the deviated septum or hollow out your turbinates or whatever. And there are potential risks with that too.
There's even a implantable device, FDA cleared, called Inspire, a mask-free. And their indication or their target market, because I can't speak to the formal FDA indication without it in front of me, is people who have tried and struggled with CPAP. Mm-hmm. Yeah. But to have did I consider that for 1 second? No, right. Mm-hmm. Like to get something implanted. But it is nice to have options when like we talked about the mortality risk of this, or when things get severe. Like I've heard of cases of people where the cognition impact was so drastic that like there was near delirium in the daytime leading up to when they got into the sleep study, and then were immediately admitted to the ICU for stabilization, like, and they could barely find the clinic. Like, so it can get bad, because
Right.
essentially people are stopping breathing as that kind of airway just collapses on itself in certain positions, and it's at there's a higher risk with obesity, but 60% or less of people with sleep apnea have that risk factor.
Right.
And you hear about people like Joe Rogan and the more plates, more dates guy. What's his name?
Derek. Yeah.
Derek talked about their CPAP journey as bodybuilders, which is kind of another risk.
Mm-hmm. Yeah. The so just a couple other potential interventions that are floating at the top of my mind. There are appliances that are basically palate and jaw expanders. So a lot of us that got orthodontia back in the 80s had permanent teeth pulled if we needed space made, but that also served to narrow our palates. So they've got these expanders that slowly expand your palate and then bone fills in. And some people report that helping, but it also can change your bite and mess up all the expensive orthodontia your parents paid for, braces when you were younger. And then there's this sort of trend of taping your mouth shut and then wearing sort of a breathe right strip to promote nasal breathing and hold your jaw a little bit, that I think was born out of James Nestor's book, Breathe. He talked about that, or Breathe or Breath, I can't remember, about mouth
Yeah.
taping.
Yeah, and this new drug that was approved, I think it's called Zepbound, but it's a GLP-1 uh, med, like,
Like Ozempic.
like there's been a lot of attention on that, but it's this glucagon-like peptide 1 antagonist, not only curb appetite, hunger, and create fullness and stuff, but I think there's also some direct effects through other pathways as well on sleep apnea, like just reducing the events. But also in the studies that got this approved, there was weight loss, and but yeah, we weren't involved in those studies, and I haven't prescribed it, so
Yeah.
can't speak to who it's a good fit for.
I'm really curious, just as my own tangent, about the potential for these GLP-1. Is it agonists or antagonists?
And they're agonists.
Agonists.
Yeah.
So, I mean, they're being prescribed for weight loss, but people are reporting, other benefits, like they stop smoking or they stop drinking, like these, it's easier for them to commit to their personal development habits. There's just sort of all these really fascinating effects that maybe might be relevant for mental health
Yeah.
care in the future.
Yeah, that's another paper, well, that we may very well review in one of these episodes, but like the role of GLP-1 in addictive disorders.
Mm-hmm.
I even had I was on an airplane coming back from a vacation, and there was a medical emergency on board. And on this particular flight, thankfully, there were several medical professionals, including like one well-known awesome transplant doc from the University of Utah, who we all just let take the lead. He was like, I think, one of my professors in med school, but I was chatting with this other guy who had just opened like a kind of a men's health clinic and did some kind of aging and some cosmetic and hormone stuff. But he was just talking about this research that was coming out and anecdotally what he'd seen of GLP-1 agonists for helping people curb addictions. And he was just asking what I'd seen in the research.
Yeah, it's super fascinating. What anything else to say about sleep? I think this pretty thorough PSA.
So, yeah, do we have time for another sleep study? There's one that's been making the the rounds in the news headlines lately.
Yeah.
About it's about kind of the getting rid of toxic waste in the brain overnight to put it in how the news headlines might. But the paper itself was in Cell, one of the top journals recently, and it's called Norepinephrine Mediated Slow Vasomotion Drives Glymphatic Clearance During Sleep. And so here's the walkthrough of it, because I think this is a very clever study that sheds some light on one of those mystery boxes, the unexplored frontiers we were talking about, and how they did it was clever too. But the scientists have always kind of had this strongly held assumption that your brain is going through some kind of gentle rinse cycle at night, washing away the day's worth of toxic byproducts in preparation for the new day and whatever else is going on in your sleep and dreams and memory consolidation. But mechanisms of this have been unknown. So these Dutch researchers, clever Dutch folks at the University of Copenhagen, Danish people, Copenhagen, they got out their suite of animal models and technologies to map the subtle rise of neurotransmitters, brain volume, blood volume, spinal fluid in mice. They had to do this in mice, both in sleep and daytime as they go about different activities to try and they also, after mapping this, they gave sleep meds to see what would happen to it. But some would call this the brain sewage network. I think, it's all talking about the glymphatic system with the G, like not the lymphatic system, but the glymphatic system has really just been identified over the last decade. It was not presented to me in med school, and it's mostly been characterized in mice, but this lymphatic system draws spinal fluid like deep into the brain's interior, and this includes the waste byproducts that we know need to get out somewhere. We haven't really understood fully how. But we were starting to understand that these things, the stuff's getting rhythmically washed away, and seems to be linked to the brainwave patterns in sleep. And so the researchers set out to see what is happening in the glymphatic system, and they wanted to track this brain cleaning process. So they tagged neuroepinephrine, the neurotransmitter, with this fiber optic implant to activate light-sensitive genes that they'd engineered into the animal's brain tissues so they could monitor the fluctuations of waste removal. And then what they found was that the neurotransmitters they monitored, like norepinephrine, they showed these pulsations that norepinephrine would drive these like rhythmic pulsations or oscillations in the glymphatic machinery that would clear the brain out. And then they went and gave Ambien and showed that the drug reduced these oscillations a bit and impeded the ability for the CSF to kind of move through this washing process. And so everyone's been in the headlines anyway, freaking out a little bit, or people send me the article and be like, does this mean the Ambien I'm taking is terrible? So anyway, that's a study to get your reactions on, at least my best, but still mediocre attempt to describe something very complicated.
It sounds very complicated. Also just amazing what they can do in these studies to these poor rats. But yeah, I mean, of course, like the people that are sending you the study, that was kind of my first question or reaction. Does this mean these sedative hypnotics like Ambien, although they might help you get to sleep, and that's something I'd heard about Ambien for a long time, that it messes with sleep architecture, not unlike the way alcohol might. Alcohol is a CNS depressant, might put you to sleep, but it's going to interfere with your sleep quality.
Yeah. And I, as a prescriber of Ambien, I agree and still prescribe it, and you sometimes carefully, judiciously, and one might ask why. And it's because, um, I believe from my experience with countless clients and personally that, some sleep is better than no sleep. And sometimes, you need to get out the big guns to help someone. Like I've spoken about this before, but when I've worked with, say, torture victim refugees with some of the worst PTSD and incident trauma events that I could imagine, and have not been able to really close their eyes into a sizable amount of deep sleep for many months, for example. Yeah, like I could say that the careful use of psychopharm in some people I've worked with has been extremely important. And I assume and imagine and confidently hope that it's been well worth the slight hit on the lymphatic system.
Yeah. Yeah. And I've heard you share that before, and I remember it really making an impact on me, because I used to be a bit of a purist when it came to psychopharmacological interventions for sleep, just out of
Yeah.
this worry that and certainly you can develop a dependence on these things, and where it becomes impossible to fall
Yes.
asleep without them. So,
Yeah.
but you're talking about a very
Sure.
nuanced approach, but I think in summary that some sleep is better than no sleep in these cases is a good rationale for using these
Yeah.
tools when we need them.
So we've been kind of all over the sleep landscape here a little bit. So I might just sum it up to say that, um, yeah, like if you do track, there is good, reliable data, but be careful not to sleep shame yourself, and just be thoughtful, like you would with anything, intentional. Like, why am I putting this strange mushroom into my body, or why am I putting this ring on me to go to sleep? And is it, yeah, is it improving quality of life or taking away in ways I might not be appreciating? Because I'm glad you brought that up or started that part of the discussion. But and then also get, if don't take sleep apnea screening lightly. Like, it is so easy. You can go to, like, I went to sleepdoctor.com. It was not an endorsement because there are many of them out there, and paid less than $200 to have a home sleep study with the Watch PAT technology that does positions and oxygen, whatever, and one consult with a sleep doc as part of it. And there are a bunch of different approaches to that. So anyway,
Well
that's
said.
our sleep chapter.
Sleep chapter. Well, why don't we maybe just talk about a few interesting psychedelic studies with the time we have left?
All right.
There was a case study that caught my eye. It's a recent case study published in Psychiatry Research Case Reports. Very recent, just here in 2025. And it's entitled, Could Psychedelics Be Useful in the Treatment of Patients with Personality Disorder? A case report of psychotherapy with concomitant use of psychedelics. So we've talked about on the show before the potential use cases for psychedelics for personality disorder, and this sort of sparse research that's been done. Because the conventional wisdom is that perhaps psychedelics wouldn't be as effective for people with significant personality disorders compared to people with mood disorders that don't have personality disorders. So this, and the authors make the disclaimer, this is a case report. So we can't really make treatment conclusions based on this case report. Case reports are usually just like, hey, here's an interesting case, and then a call for more research. So I'll tell you a little bit about this case report. This 37-year-old woman who had a very significant trauma history, a family history of psychotic disorders and mood disorders and substance use disorders, who had been diagnosed with a lot of different things. And you see these poor folks who might have personality disorders, they've gotten lots of different diagnoses throughout their interactions with the mental health system. So this person comes to this clinic after having inpatient treatment and a lot of different diagnoses. And through their evaluation, they decided she had what they're calling mixed personality disorder and ADHD, actually. So during their thorough evaluation, they felt like she met diagnostic criteria for borderline personality disorder, antisocial personality disorder, narcissistic personality disorder, and paranoid personality
So
disorders.
it was not multiple personality disorder. It was multiple personality disorder diagnoses.
Correct. So yeah, not
Yeah.
dissociative identity disorder, but just lots met diagnostic criteria for several different personality disorders, and then also ADHD. And so came to them for treatment, and they put together this, comprehensive treatment program. But then this patient disclosed her intention to also use psychedelics on her own. She was done with traditional pharmacology, hadn't worked for her. They even tried her on methylphenidate to help treat her ADHD. She didn't tolerate it well, and she stopped it. So she says, I'm going to be doing these psychedelics. Are you folks cool with that while I'm engaging in psychotherapy? And they decided, for reasons they outlined in the paper, that would be okay. So she obtains the psychedelics on her own through her own sources and does both micro and macro dose experiences with a variety of psychedelics. I'm trying to find it here, but she did, I think, psilocybin, LSD, mescaline. She even tried Amanita muscaria at one point. Yeah. So
that is a wide range.
MDMA
Most
as
people
well.
don't end up, I guess, it is different now. They sell Amanita gummies with who knows what in them at the smoke shops. But
yeah,
it's not your most commonly microdose thing these days. Otherwise.
So again, a case report, right? This wasn't like a controlled study of her psychedelic use. But just sort of interesting that here's a person that, in a clinical trial would have been screened out for having typically these personality disorders, who decides on her own accord that she's going to do this. And so, long story short, what they found that in combination with the therapy and these psychedelics, that this person's conditions improved significantly. So much so that after a year of treatment, I'm reading here, personality pathology was largely improved. She did not meet narcissistic or paranoid personality diagnoses anymore. And even though borderline and antisocial diagnoses were maintained, the borderline symptoms were largely improved and became mild. Obsessive compulsive symptomology was also largely improved, as well as narcissistic vulnerability. Grandiosity, though, was less improved. More, better at impulse regulation, emotion regulation.
Wait, grandiosity worsened or improved, but not as much as the others?
Yeah, it didn't improve very much, but did not worsen. So less improved, according to their evaluations.
Yeah, it is really interesting, and it's cool they were able to publish this given the regulatory and legal landscape, and where a lot of people are either don't know how or are worried to share that, both on the researcher and participant standpoint.
Yeah. And they also, took a researcher's approach to her independent use of psychedelics and having her carefully measure and monitor and report on sort of what she took, when she took it, how much she took. So they had that
done. Oh, by the way,
they had that data. Where was it done?
I'm guessing it's outside of the U.S.
It is, judging from the names of the authors. I don't know.
It's because, I think the journals and their, ethics board requirements might get too jumpy in the U.S. still on a case report to that extent. Even as much as I love the data and wish we could more freely publish good scientific stuff across the board.
Yeah, published in Psychiatry Research Case Reports, which is not a journal I'm familiar with. So I don't know if that's a U.S. one.
Cool. It reminds me of, did you see, I know this is not a multiple personality disorder or dissociative identity case, but did you see the movie Split or Split 2?
I've seen Split, the first one.
Yeah, they're both M. Night Shyamalan movies. And it was the second one actually, where it starts with this lady, Dr. what's her name? Ellie Staple. She's like, I just remember this line and the way she says it. My work concerns a particular type of delusion of grandeur. It's a growing field. I specialize in individuals who believe they are superheroes.
Oh, interesting.
And I thought, hey, that's a cool niche, lady.
Yeah, apropos for that particular show.
But when Unbreakable came out, which was kind of tied to the series, right, earlier on, Samuel Jackson, Bruce Willis, I was kind of thick in the genetics world, and remember I really liked his play on this concept of Samuel Jackson is born with osteogenesis imperfecta, a real condition that gives you very fragile bones, but then like synchronistically or whatever, Bruce Willis runs into Samuel Jackson, and Samuel Jackson's like, maybe if there's someone as fragile as this, there's someone on the other end of the spectrum. And Bruce Willis had just survived, the only one to survive a train crash. And he's like, why can I bench 350 and stuff like that? So, yeah, it was just fun to think about how genetic variations do go either way. And some things that give you risk in some areas give you protection, like sickle cell might give you protection against malaria, something like that.
Yeah, that's for the light and shadow side. That's fascinating.
Yin Yang Genetics.
There you go. Good company name. So yeah, that's kind of it. I mean, this they recorded this person's sort of anecdotal report on their improvement on doing these things, and it's not unlike what we sometimes read when people talk about the so-called miracle cure of psychedelics. Not that this person was all better, right? I'm still struggling a lot, but it felt hopeless and isolated and deeply depressed, and that using psychedelics in combination with all the good psychotherapy that she got helped her feel her emotions better, accept herself more. So it's pretty cool. But I will repeat the disclaimer that this is a case report and not a recommendation to do any of these things. Just fascinating and might inspire future research for an underserved population of folks who've been diagnosed with personality disorders.
Yeah, that is an interesting one. Would you like another psychedelic study? This one's brief because it's not published yet, but it's been announced.
Yeah.
By Beckley, who we are working with in our research clinic on a study of 5-MeO DMT intranasal for treatment-resistant depression. And just 3 days ago, from the time we're recording this, so very late January, Beckley, a biotech out of the UK, announced positive, what's called top-line findings from their open-label phase 2 study of this same drug for moderate to severe alcohol use disorder, and showed that treatment with this version of 5-MeO DMT might bring about meaningful and sustained reductions in alcohol use and what we'd call in the field heavy drinking days, the number of heavy drinking days, for up to 3 months after a single dose. And this was given in combination with relapse prevention, CBT. And it was a sample size. I'll give all the key things that you might be asking, not all of them, because this is, again, just a press release where the presentation is coming soon and the publication is probably in the works for later in the year, I'm guessing. But the sample size was 12 people, adults with moderate to severe alcohol use disorder, and the mean number of alcohol units per day decreased from 9.3 in the weeks leading up to dosing to 2.2 at 12 weeks post-dosing. And the percentage of heavy drinking days dropped from 56% to 13% at end of the study. And the mean number of abstinent days increased from 33% to 81%. 50% remained completely abstinent at 12-week follow-up. There you have it, hot off the press.
Yeah, those are exciting results.
Pretty cool, huh?
Pretty clinically significant reduction in those heavy drinking days.
Yeah, it reminds me of what the early LSD studies were showing for alcohol use disorder. We've talked about them on here, and I won't go into that data, but back then, especially in Canada, there were, I think, about at least 2,000 people who went through this protocol of LSD plus therapy for alcohol use disorder, and it appeared to be quite a bit better than antabuse, like a gold standard on the market, kind of one of the treatment options. But if you think about accessibility, like, one, I hope LSD studies in this modern era are done on alcohol use disorder. But also, there's something really interesting about a very short duration potent psychedelic in a single dose combined with therapy in terms of its potentially practical accessibility. I said potentially because, it also is a potent psychedelic being explored for clinical uses.
Right. Yeah, I think generally that's one of the exciting potentialities with psychedelics, that if they can provide these single or double or triple dose experiences that then lead to significant improvements that are durable, then you're going to increase accessibility just for people who can't do a treatment every day for their entire lives, or and hopefully we can make it affordable enough.
Right? Prefer not to. Yeah. So maybe one other rapid fire study like this from one of our other sponsors we work with.
Yeah.
Because this one's has been out for many months now, but it's also a presentation, poster presentation that I was on with MindMed about the LSD for anxiety data that we presented at several meetings last spring, summer, and are still working on the publication for. But the title of the abstract you can get from MindMed's website. But I love sharing this because we got to work on the study, and you and I both got to sit in the room with many participants for these dosing sessions. Not all protocols let the PI step into that role, so I like it when I get to do that. But this basically was 198 participants enrolled, and it was the phase 2 dose finding study for generalized anxiety, looking for one, does LSD help with GAD, and two, what dose? What dose is the best balance of risk benefit and should go into the phase 3 program? And the primary objective assessed was the gold standard anxiety questionnaire, the Hamilton Anxiety, HAM-A, looking at baseline, so the beginning to week 4, and both the 100 micrograms and 200 micrograms top doses showed clinically and statistically significant efficacy, and the 100 microgram dose had a 7.6 reduction HAM-A compared to placebo. The reduction in the score went down 21 points on that dose of MM120 or LSD 100 micrograms, and it went down 13 point something on placebo. And so the p-value of that is like 0.0004, highly significant. And so that's the gist of it. And there were other measures that this was a rather exciting finding to see after the study. I mean, we had a hunch that there was benefit, but this was placebo controlled. So we did not know beforehand what people were getting, nor did they. But to see it bring about that much meaningful improvement in anxiety scores compared to placebo was highly encouraging for me, and we're excited to be starting the phase 3 right now, LSD for GAD, that people can call into our research clinic for. You can go to numinous.com or cedarclinicalresearch.com. Still goes there as well, I believe. That's my plug.
Yeah. Yeah, exciting results and also a little counterintuitive for some. Like when I've told people about this study, and people who know LSD a little bit, they're like, LSD for anxiety? Damn. 200 micrograms
Totally.
LSD gives me anxiety. I don't know why that would be helpful. Of course, that's just some people, but
That's exactly what Humphrey Osmond and who's the other psychiatrist said. They were at a conference. These Saskatchewan docs who did the alcohol LSD research back in the day, they were like, late night having a drink at the bar at this academic conference, catching up. And they're like, what if we gave LSD to people with alcoholism to really put them through the dark night of the soul? And they're like chuckling and they're like, wait a second, what if we do? And in fact, when people go through a rough episode of delirium tremens, when they withdraw, like a very, very challenging experience, they're much more likely to have some abstinence for a time, for a longer time. And so they went out and did it. But I could say this isn't, in our experience with the study and what's reported, this was not a dark night of the soul for like predictably. That wasn't even a formal AE, dark night of soul, but but they can be challenging, and that is part of what went into choosing the 100 microgram versus the 200 microgram dose as the optimal, like by the sponsor for the next phase of the program.
Yeah. So that actually is maybe a potential segue into one other study that I wanted to talk about, psychedelic study, because it involves dosages and more not necessarily being better. So this was a study, let's see, acute dose-dependent effects of self-guided titration of continuous N,N-dimethyltryptamine, so DMT, infusions in a double-blind placebo-controlled study in healthy participants. So double-blind placebo-controlled study, but these were quote-unquote healthy participants, so not a psychiatric indication. So they got 22 participants that underwent 5 randomized test sessions and then a non-randomized titration session. So they received placebo or DMT via, I guess, an IV. And first they had sort of these varied doses that they gave them, and then they allowed them over 2 hours to, once they reached a certain threshold, to sort of self-regulate how much DMT they got. Up to
DMT, patient-controlled pump.
There you go. So they found that people liked a moderate psychedelic experience occasioned by the DMT, as opposed to one that caused anxiety and intense ego disillusionment. But they also didn't like it to be, really mild. So people tended to titrate themselves up to, I think it was 1.8 milligrams per minute over a 120-minute infusion.
That's fascinating. That's a cool study to see where people, like, I have so many questions, probably more than we would want to dive into on this. It just, about what that means and what to make of people's preference and how much we are also wired for avoidance sometimes of the difficult things that might be helpful. But so, you know what I mean? Like, and how much should that be factored into the equation? Yeah.
Right. Yeah, we've talked about it on the show before, that, and even you mentioned it when we were talking about LSD, that sometimes the breakthroughs are on the other side of the distress, and it's the in and through that is sort of the ticket price to getting some of those breakthroughs. So if you're self-titrating, you might be keeping yourself from going through and enjoying that particular revelation or breakthrough. But these people reported some strong positive effects.
Yeah. And I would, like, that question I brought up is just like, I think it's a curiosity shared probably universally, but I find it really interesting to think about the varieties of the psychedelic experience and how there's so much individual variability in response to dose, and just our readiness given where we are at a certain time point in our life, matters in this equation as well, of where we might gain the most benefit on the spectrum of doses and experiences. And there, like we say in the ketamine world, as we're working on sometimes like, escalating doses over time, but we're also working on trying to get as much out of a given session, whether it's a very low dose or not, that we can, and working with the participant to try and find value at all those places.
Yeah, I like that. Find value at all the places. So there were some other interesting data they collected about endocrine effects and pharmacokinetics and other potential benefits of this protocol. There are other groups that are doing sort of the so-called DMTX studies and protocols, the extended state DMT via IV. And I think it's Alexander Beiner. It was reported on his experience in that study as a participant pretty eloquently. He wrote a book called The Bigger Picture, which is where he talks a bit about it and other existential topics. But at any rate, how's that for a eclectic smorgasbord of studies today?
Wow, we were all over the place. How about I throw in one quote from the movie Unbreakable to wind us down.
Yeah,
by Elijah Price, who said, I wish I had a Samuel Jackson voice impersonation, but it's hard for many people to believe that there are extraordinary things inside themselves as well as others.
Deep
yet not. What did you say? We were starting a psilocybin session in research clinic the other day, and you came in and busted out a movie quote that people around found profound.
I think the participant was feeling self-conscious about being late, and I think I quoted Gandalf from Lord of the Rings. A wizard, and not perfect quote, but a wizard is neither late nor early. He arrives precisely when he means to. And there was a nice chuckle, and tensions were eased.
It was the message that was needed in that moment.
Who knew? My my affinity for really nerdy movies and books would have been helpful.
Yeah. Well, it's been fun, Steve. I hope we have a few listeners that still remain at the end of this long meandering through science land.
Rewarded by our movie quotes. How about that?
Yeah. Well, thank you, dear brave listeners. And thanks, Steve. It's always a pleasure.
Pleasure as always. Psychedelic Therapy Frontiers is brought to you by Numinous Network, a company committed to helping people heal and be well by delivering technology-driven clinic support, clinical trial research, and comprehensive practitioner training in psychedelic-assisted therapy. You can learn more about Numinous Network at numinous.com. That's numinus.com. If you enjoyed the show today and you want to support us, here's how you do it. You can leave a rating or review on places like Apple Podcasts and Spotify, subscribe to the Numinous YouTube channel, like the YouTube videos, and share the show with somebody you think might enjoy it. If you're interested in comprehensive training in psychedelic-assisted therapy, check out our courses at numinous.com/training. These courses are carefully crafted by Numinous professionals like myself, Reid, and others, and include live online classes, experiential learning, and opportunities to connect with a diverse community of practitioners in the psychedelic medicine space. I really love teaching these courses and connecting with you all, so check out numinous.com/training, and I hope to see you at the next training cohort. The content of this podcast does not constitute medical advice or mental health treatment. Please consult with a medical or mental health professional if you believe you are in need of mental health treatment.